This video lecture is on personality assessment. Personality, what is it? How can it be measured? So when we think of personality, we can think of broad characteristics about a person. These include patterns and tendencies that are deeply ingrained within people. And personality assessment is important because it can help identify client patterns that keep them stuck. It can help select interventions, assist in treatment decisions, assist in structuring the counseling relationship, and it also helps to identify psychopathology as well as strengths and weaknesses. Personality characteristics inevitably show up both in the therapeutic relationship as well as with interpersonal relationships outside of the therapy room. Personality assessments can be either objective or projective. And so, with objective personality assessments, we think structured assessments such as questionnaires, self report inventories, or rating scales. Projective personality assessments are unstructured, ambiguous stimuli that may be incomplete, and a person's responses are not limited to specific options. So, with projective, we think things like the Rorschach or the thematic apperception test, and we'll go a bit into those at the end of this lecture. There's also informal personality assessment techniques, which mainly include observation. So, observation is the most commonly used method of informal assessment. And really, what this means is observing interactions with the client when you're present with them. And it's important to keep in mind that there is subjectivity as far as the counselor goes, right? So you're bringing in your own personality and your own biases into your observations. And so some things to keep in mind may be selective recall, selective interpretation, and also pre-existing assumptions. So we may assume things about people based on other factors. And other things to keep in mind are just reliability and random error, as well as validity. So there are some issues as far as subjectivity goes when we're using informal assessment techniques. As far as structured personality inventories go, methods of constructing personality inventories include content-related procedures, personality theory, empirical criterion keying, and factor analysis. So these are all methods of constructing personality inventories. And you can also read more about these in your text in Chapter 12. And the instruments that are most often used by counselors are the MMPI-2. This is the most widely used personality instrument. The NEO-PI-3, which I won't go over in this lecture, but you can read about it in your text in Chapter 12. And also the Myers-Briggs Type Indicator, the MBTI. So let's first just take a look at the MMPI-2 because this is the most widely used. So this is a criterion keyed instrument that's used to diagnose emotional disorders. And there is also an adolescent version for ages 14 to 18, and the MMPI-2, the regular version, that is for people that are over 18 years old. And so some of what you should know just to generalize yourself with the MMPI, it's 567 items that are true, false, or cannot say. An example of an item from the MMPI is I cry easily. And so the responder would say true, false, or I cannot say. And there's a norming group of 2,600 people selected to match the 1980 census data. And there is some debate that exists about racial bias because the norming group had a high proportion of individuals with advanced educational backgrounds and higher status occupations. The MMPI also contains validity scales and 3 types of clinical scales: basic, content, and special scales. And if you look on page 250 of your text, you can see all of the scales that are existing on the MMPI. So here are some of the validity scales. We have cannot say, variable response inconsistency, true response inconsistency, F scale, infrequency. We also have the infrequency back scale, psychopathology infrequency scale, symptom validity scale, lie scale, correction scale. And basically, what you should know about this are that the validity scales tell you how truthful the client is being. And so that's why they exist, and it's a really nice feature of the MMPI. So, the basic clinical scales that exist within the MMPI, you can see here. So, hypochondriasis is the first clinical scale, and it's related to excessive concerns with health, as indicated by reporting the presence of bodily complaints. Depression scale. So elevated scale scores on scale 2 suggest feelings of hopelessness, isolation, or discouragement. Lower scores on the depression scale tend to indicate that people are more optimistic, gregarious, and alert. The conversion hysteria scale. So this scale has to do with a combination of denial and social flamboyancy. So when we think about the conversion hysteria scale, elevated scores reflect tendency to deny issues. They often People with elevated scores on the conversion hysteria, they tend to react to stress and anxiety with physical symptoms, and they often have a lack of insight into their own motivations and actions, as well as others' motivations and actions. The psychopathic deviate score scale, it has to do with if there are higher scores on this scale, it reflects hostility towards social conventions, authority figures, and could be also family members. So higher scores here on scale 4, psychopathic deviate, tend to include moody or irritable, resentful, or impulsive feelings, often people that blame others for their troubles. The scale 5, masculinity, femininity, it provides a measure of whether the individual's emotions, interests, attitudes, and perspective on social relationships and work are consistent generally with male or female. And the paranoia scale, scale 6, it has to do with whether there's a pattern of suspiciousness, mistrust, delusional beliefs, or interpersonal sensitivities. So higher scores on this are characteristic of sensitivity, and it could also indicate that the individual has a tendency to misinterpret intentions or motivations of others. Psychasthenia, scale 7, this is looking at some symptoms associated with anxiety and obsessive compulsive disorders. And so elevated scores may indicate tendency towards anxiety, rumination, self-blame, and feelings of insecurity. Really high scores can be associated with obsessions and rigidity. Schizophrenia, scale 8. This is measuring and looking at whether people have strange beliefs, unusual experiences, and emotional problems. And it also looks at difficulties with fluid train of thought and mental processes. Higher scores may also reflect alienation. Hypomania, this one is looking at hypomanic behavior such as energy, hyperactivity, and euphoria. And as scores increase on this scale, individuals are often spending more energy but are less efficient. And so they might have overactivity or flight of ideas or emotional excitement, but it also may mean that they're easily frustrated and are irritable. The social introversion score are associated with preferences for being alone. And so this may be indicative of some schizoid type of personality disorder. And this is just something to keep an eye on. And if you recall from class, we learned that the difference between social anxiety and something like schizoid is that people with schizoid don't tend to want to have social interactions, whereas those with social anxiety do want to have them, but they don't because of being fearful of them. So moving on to the Myers-Briggs type indicator, the MBTI. So this is a commonly used personality inventory that's actually often used in career counseling. So it's for individuals 14 years and older based on Jungian theory. And it's a typology instrument that provides scores on 4 dichotomies, which results in individuals being categorized into one of 16 psychological types. And so this MBTI measures personality type and preference. It does not measure pathology, so as opposed to the MMPI, which does measure pathology. And all of the MBTI is self-reported, so bias should definitely be considered. And here's some examples of the dichotomies that exist in the MBTI. So the first set of dichotomies is extroversion and introversion. So we can think of extroversion as directing energy outward, introversion directing energy inward. Sensing, observing through physical senses. So we could think of a preference for using the 5 senses. People perceive what exists versus intuition, which is using insight. Or we could think of this as people that use hunches and perceptions of patterns. The next dichotomy is thinking and feeling. So the thinking personality type is more about analysis, objectivity, being rational and logical, versus the feeling, which is where an individual primarily uses personal or social values in making judgments. And then last but not least, we have the judging and the perceiving dichotomy. So the judging is more of planner, setting things out, planning how they're going to be, versus perceiving flexible rather than fixed. So we could think of perceiving as sort of going with the flow. And the preferences on the 4 continuums result in a 4-letter code producing a personality type. And again, counselors should be familiar with reliability and validity evidence for this instrument. There is some controversy around it. It's somewhat lacking due to the subjectivity of the self-reporting responses. And so really there is some reliability, but again, there has been varying evidence to show that it's kind of ranged as low as 0.76, but often an average coefficient of 0.82. And so to just be familiar with this is important, and you can read more about that on 258 of your text. And so here's an example, and you might just pause the video for a moment and do this activity of answering these 4 questions and then giving yourself a letter. So go ahead and decide what you would be on each of these 4 scales. And so if you've given yourself the questions and you've written down your letters, you can see here all of the different categories that exists. And these are how they're described in a breakdown. So I'll just go back here, for instance. So let's just say we have an extroversion, thinking, sensing, and judging, ETSJ. So I notice on here, ETSJ is actually not a common one. So these are the most common. And so let's look at ESFP. So if we go back, we have extroversion, sensing, feeling, and perceiving. So in the bottom left, ESFP, the second row from the bottom one in, we can see that this personality type is playful, enthusiastic, friendly, spontaneous, tactful, flexible, have strong common sense, and enjoy helping people in tangible ways. So you can kind of play around with these, and you might think for yourself, how could some of this information be helpful to know as a counselor? And how might this also be useful in career counseling? So the 16 personality factor, Raymond B. Cattell and colleagues, as part of hybrid this week, you'll have an opportunity to actually take this personality inventory. This was developed through factor analysis, ages 16 plus, and it considers 16 factors as elements of personality. So you can see these here: warmth, reasoning, emotional stability, dominance, liveliness, rule consciousness, social boldness, sensitivity, vigilance, abstractedness, privateness, apprehension, openness to change, self-reliance, perfectionism, and tension. And then it considers 4 global factors, which are extroversion, anxiety, tough-mindedness, independence, and self-control. So here's some limitations of standardized personality inventories. The majority, just like all of the ones we went over, are self-report instruments. And so clients are able to distort results, and they might fake being good or bad for a number of different reasons. There's a risk of different types of response sets. And here's some ways to increase the validity of profiles. Inform the client of the purpose of the inventory and how the results will be used. So we can talk about, this open communication about the inventory and how you'll use results. Instruct the client to answer each question honestly, and also ask the client to focus on each of the questions. Because a lot of these, such as the MMPI, have so many questions, often clients can get lost in thought, or they might get bored, and there might be a tendency to rush through. So really taking some time to support the client with this by addressing it. So I'll just go a little into projective techniques just so we have an overview. Projective techniques are not as commonly used at this time because of the lack of validity and evidence, due to there being such a high level of subjectivity. But basically, projective techniques provide clients with relatively unstructured stimulus, and then the examiner records and interprets the responses of the client. And so these are based on the psychoanalytic concept of projection, which is that individuals' tendency to project their drives, defenses, desires, and conflicts onto external situations or stimuli. So these are thought to uncover more of a client's unconscious and thus provide an indicator of covert or latent traits. So it is more difficult to fake responses because they're not just yes, no, or other, but there is a fair amount of subjectivity, obviously, when presented with such an open-ended stimuli, as well as bias from the interpreter. So as I was just saying, includes significant subjectivity and interpretation. There needs to be a very detailed amount of training, typically a doctoral level person. So in doctoral level programs, there'll be an entire class just on interpreting, for instance, the Rorschach. And so some categories of the projective techniques include associations, construction, completions, arrangement or selections, and expression. And these are just the 5 categories. So for association, we can think ink blots or word associations. Construction has to do with stories or biographies. Completions of sentences or cartoons, arrangement or selection of toys or verbal options, and then expression, which could be drawing or dance. So the Rorschach inkblot test, it's a well-known association technique. It consists of 10 inkblots with 5 cards in shades of black and gray, 2 in black and gray with additional touches of bright red, and the remaining have pastel colors. And so typically the inkblots are presented in 2 phases. They're presented in one phase where the examinee responds to them. And in the second phase, the inquiry phase, the examiner goes back through the cards and in a non-directive manner questions the examinee on what prompted their responses. Another construction technique is the thematic apperception test. And so basically, this examines the client's ability to construct a story based on a picture that's shown to them by an examiner. So it'll typically be some sort of scene, for instance, that's being played out, and then the person needs to construct a story about it. Completion techniques, the Rotter incomplete sentences in blank second edition. And so, for example, examiners might be provided with an incomplete sentence and asked to complete the sentence in their own words. So a sentence could be I hope, or people, or at home, or I get upset when. And so they're being asked to complete the sentences. Arrangement or selection techniques. You might have heard of some of this for work with children. So there's sand play, there's play with toys, there's use of puppets. Other expression techniques include drawing techniques. So there's the draw a person test, house tree person, kinetic family drawing. And the kinetic family drawing is actually an interesting one. So the counselor uses this by asking the child to draw the family doing something. And so it can really help people to see a clearer picture of family dynamics. And you can also kind of interpret and look at actions, distances, barriers, positions, physical characteristics of the figures, styles. And if you look on your text in page 264, figure 12.4, you can see an example of a kinetic family drawing. So some strength or productive techniques, again, they're more difficult to fake, can sometimes identify more complex themes and multidimensional aspects of personality that we can't get from just saying yes, no, or maybe. Can serve as an effective method of establishing rapport. This is certainly true, especially with children, right? So you might do something like kinetic family drawing or sand play with a kid who isn't so verbal, and using some of these methods might make them feel a little bit more comfortable. And it can also be helpful for nonverbal clients. And then the limitations, very low reliability evidence for these. More caution is needed when interpreting results, meager validation information, and just an overall lack of normative data. And again, can be really dangerous with untrained users who are making interpretations that are not based in research.